What makes SunCloud different? I've been around the block a few times and I've consulted with a lot of programs. I think one of the things that makes SunCloud unique is not only its authenticity, but its openness. And I alluded to this earlier in my comments. Um, Knowing that you don't know is important in the field. And all too often, people think they know. And the whole idea of research is to be open to new ideas, new ways of thinking, new ways of treating individuals so that they can have a better outcome. SunCloud treats a lot of very seriously ill patients, and it's one of the few places in the country that welcomes people with both eating disorders and substance use disorders, and also acknowledges the reality of ultra-processed food addiction. That is an extraordinarily unique place that does that. Most places who focus on eating disorders, they may certainly have some people with substance use disorders, but they're not a primary problem typically. And they tend to be substance use disorders that are less pressing, less serious. Cannabis and alcohol are certainly common, but SunCloud will treat people with primary substance use disorders. And that's a rarity. Uh, and it's also one of the only places in the country that I know of at a higher level of care where people can get an assessment of their food addiction, their eating disorder, their substance use disorder, and their trauma and PTSD and get treatment for it in an integrated way. And that is really unique in my experience.